Welcome to the EAU podcast series, Women in Urology. Dare to Thrive. In this episode, my andrologist is a woman, redefining expectations. We are joined by Dr. Nadja Stivalet and Dr. Marta Skrodzka. Together, they will discuss how female andrologists are challenging stereotypes, redefining patient expectations, and fostering more open and empathetic conversations around men's health. Join us as we embark on this informative journey.
Welcome, everyone, to EAU podcast, My Andrologist is a Woman. My name is Marta Skrodzka, and I'm a consultant urologist and andrological surgeon working at St. George's University Hospital in London, United Kingdom.
Hi, everyone. I'm Nadja Stivalet. I'm a urologist and andrological surgeon in Paris, France. I'm also a member of the French Committee of Andrology and Sexual Medicine.
Today, we're talking about a space often thought as for men and by men, andrology.
But what happens when women bring their voice, empathy, and expertise to men's health, Marta?
When I first told people I wanted to go to andrology, a few eyebrows definitely went up. Through my training in andrology and urology, I would hear, but that's men's health, are you sure? As if empathy or curiosity about men's health being somehow needed to come with a Y chromosome.
I know that look. I had it when I became urologist, and then when I got interested in andrology. But it's also a smaller specialty in urology, so you manage to get some space eventually. The idea that andrology should be gender restricted still lingers, even though. But, it's like gynecology. Some men are interested in female health. Why women cannot be interested in men's health too? Also, don't you think that being a woman can be an asset for this specialty?
Yes, I couldn't agree more. Andrology isn't just about organs and hormones. It's so much more. It's also about identity, confidence, and connection. And being a woman in that space sometimes helps patients to see that vulnerability isn't a weakness. It can be a part of healing. Many male patients tell me that they feel more comfortable opening up, talking about intimate problems like erectile dysfunction, body image, or relationships. This is maybe because as a woman we're perceived as less judgmental or competitive. And sometimes it's not even about gender. It's about the kind of space we create.
Yes, of course. Early on, some male colleagues or even patients would ask, how can you possibly understand what I'm going through? But understanding doesn't have to come from the same anatomy, It comes from listening, studying, and caring deeply. Once patients experience that, the gender question fades. It opens the doors for more nuanced conversation, not just about testosterone or anatomy, but about how men see themselves, see their relationships, and their well-being. And sometimes they're also interested in female opinion and the feminine point of view.
I agree, and the available data backs that up. Studies consistently show that communication, empathy, and the ability to build trust improve outcomes in sexual health and reproductive health. And those aren't female qualities per se, but they're often strengths women bring to medicine. And fairly, it still surprises me how many people think andrologists just prescribe a blue pill or do prostate exams.
Yes, I agree. Prostate is is often included, but it's not the only thing that you can do with andrology. Andrology covers the full spectrum of men's health, sexual function, hormones, fertility, testicular disorders, even the psychological aspects of masculinity and aging. So it's definitely not just prostate.
Exactly. We're talking about men's health across all life stages, from puberty through fatherhood to older age. And those transitions come with physical and emotional shifts that deserve care.
Yes, and that's part of redefining patient expectations. We are not just fixing a problem, we are forming partnerships with them. We support men at every stage of life, by providing prevention, focused guidance on sexual and fertility health, treatment for sexual dysfunctions, including surgery, and personalized advice to enhance sexual well-being. It's not just prescribing the blue pill or do a prostate exam. It's much more than that.
I agree. And patients come to us with symptoms like erectile difficulties or low libido. And yet in the process, we may end up talking about things that seem completely not related, like stress, anxiety, sleep, communication, and self-esteem. It's very important to remember, and I always remind this to my patients, they're not a set of symptoms. They are actually a whole person walking into our office.
And sometimes when male patient realize his doctor is a woman, sometimes there's that split seconds of surprise and discomfort. But really, it never became an issue for me. Do you agree, Marta?
Yes. And if I sense discomfort at the very beginning, I acknowledge it. And if possible and available, I ask if they prefer to be reviewed by the male member of the team. But it's usually not the case. I focus the conversation on professional aspects, providing flow and safe space. And my observation is that this usually breaks the ice. And when stress is built, gender becomes irrelevant. Or as we actually said, it actually can become an asset. I recently had a patient from Poland who actually found me online 8 years after I moved from Poland and asked me to recommend a female andrological surgeon. I asked why he was looking for a female specialist, and he said he felt more comfortable undressing in front of a woman, and also mentioned that he believed women are more gentle and pay greater attention to aesthetic details. And it's obviously subjective opinion, and any form of generalization may be biased, but patient perceptions vary and it matters. We should always consider this.
Yes, we should consider, and also we have to involve partners, especially in sexual health and fertility. It completely changed the tone. Sometimes it's not his or her issue, it becomes a shared one. And when couples attend together, communication improves too. And the emotional load lightens. It's really important.
Exactly. I remember this couple from several months ago where the husband has been actively avoiding any medical testing for years, and his wife managed to persuade him to come and see me. And during the session, I remember we unpacked quite a lot, not only about medical fears, but also emotionally, including sense of masculinity, failure, and expectations. And at the end, they both ended up crying and thanking each other. And I remember this was quite something. Andrology can actually be a completely different dimension if we open up the space.
Yes, really, that's the heart of it. Andrology isn't just a male domain, it's a partnership.
I couldn't agree more. Nadja, I believe our conversation wouldn't be complete without touching the struggles. As surgeons, we work in male-dominated environment. Do you want to share your experience?
Yes, of course. As the women in surgery, we are claiming our space, of course, but it requires really a lot of strength and perseverance. We are often taken less seriously than men in public and professional life. And this includes being underestimated and overlooked. And women are also a lot questioning themselves and seems less confident than men. And I think they feel less legitimate and they need to work harder to show themselves, to show everybody but themselves also that they are worthy.
Couldn't agree more on both points. I recently came across a very interesting book that illustrates this perfectly. It's called The Authority Gap by Mary Ann Seagard. It touches multiple topics that are so important to us. No matter how powerful a woman is or how high achieving she may be, she's usually not granted the same authority as men of similar or often lower status. And it isn't just about sexism. It's also about the subtle little everyday experiences, such as being talked over, interrupted, or having one's expertise challenged. And there's one more thing that we often see in the surgical world specifically. When men assert authority, They're seen as leaders. They're seen as taking control. But when women do the same, we are often dismissed as bossy, abrasive, or angry. Luckily, this mentality in the world is changing into a more inclusive place, but this process is really slow, and it's very important we can all help make that change. That's what I feel representation is so important. It matters that more women are visible in andrology, surgery, medicine. Women should be visible as independent professionals.
Yes, representation really changes who feels welcome, both patients and future clinicians, I think. When young doctors see women leading in men's health, they learn that empathy and expertise can coexist. And they see what women can add in this specialty with a different point of view. So it's really important to show women that they can do this specialty. And it's not just a man work, of course. And when a male patient sees diversity in the team, it signals inclusivity too. Women are not against men for the same job. It's really important to say that. Expertise and skills are the only values that really matter. We can share andrology, we can share urology with men, and we can supplement each other and add some women expertise and experience to the field. And to obtain this legitimacy, we have to make things change, things that affect women's career, and not just women surgeons, really for every woman working. It's pregnancy, maternity leave, access to childcare. For my part, I have 2 children, and my pregnancies and maternity leaves affect my learning curve compared to my male colleagues. But it's my choice. It's my choice to have children. I will never regret that. But you often feel like you are inconveniencing everyone with your pregnancy. You are stressed. I was really afraid to perform X-ray guided surgery. I was afraid to announce my pregnancy. And it shouldn't be like this. It's not causing by someone in particular, but it's really some accommodations that could be made for women. And that is why we try so hard to show that women in surgery are worthy. And then we have to find some way to be surgeon and to be mothers. And it's possible, but that's why we have to make things change.
I couldn't agree more. It's really surprising how very few support systems are in place. I'm a mom of a 2.5-year-old, and it was undoubtedly one of the best decisions of my life. But I have to also admit that since I became a parent, it has been also one of the hardest periods. Coming back from maternity leave felt like climbing Mount Everest. I wasn't sure when I was ready to be on call again. I questioned my skills as surgeon, and I constantly felt guilty that I wasn't dedicated enough time either to my family or my work. It felt like a very lonely journey to find my footing, and if more support systems were in place, perhaps more women would choose to continue pursuing their careers after becoming parents. The combination of hard work, skill, and empathy is very often what women deliver to the field, and that's very valuable, specifically in a field of andrology. It's worth mentioning that diversity also reshapes the way we approach care. When different perspectives are in the room, doctors, surgeons, psychologists, nurses of different genders, we challenge assumptions and build more holistic models of care.
Yes, and I think patients feel it too. I had men tell me I came expecting to be lectured. Instead, I felt heard. And that's trust, and it's changed behavior. Men come earlier, follow through on treatment, talk more openly.
Yeah, exactly. Representation doesn't just check the box. It actually changes perspective and normalizes care-seeking behavior. It also redefines how empathy looks like.
And empathy, communication, sensitivity are not soft skills. They are core medical competencies. And when we honor those qualities, regardless of who embodies them, everyone benefits.
Yes, I couldn't agree more. To me, the message is simple. Men's health belongs to everyone. And female andrologists aren't just exceptions. We're partners in caring for half of the population.
Yes, and our goal isn't to replace anyone. It's to broaden what care can look like. And because when we bring diverse perspectives, we bring better outcomes too.
And representation matters. Female perspective enrich andrology, expand trust and accessibility. And one more thing to add. The women I had pleasure to work with in andrology were brutally well prepared.
And andrologists, regardless of gender, are lifelong partners in men's health, not just in moments of crisis, but across every stage of life.
All right. I think we'll wrap it up. Thank you, everyone, for joining us.
Thank you, everyone.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe to our EAU podcast channel on your favourite podcast app. Until next time, keep learning and stay inspired.